Today we are going to discuss about hyperemia, the causes of hyperemia and the advantage of hyperemia and when the hyperemia occurs. Hyperemia. So the word hyperemia means hyper mean increase, emia mean blood. So as we know that every organ is supplied by blood supply. For example, I made right here a skeletal muscle and for example here I draw stomach or intestine. So every organ, every tissue is provided by blood supply. So for example, this is I made skeletal muscle and GIT system. So for example, here the blood vessels which are providing blood supply and nutrition to the tissues or muscular tissues, and here also the blood supply providing blood to the GIT system or somewhat like. So these are the blood vessels providing blood supply to GIT system. So for example, during a rapid metabolism, whenever you perform heavy exercise, so what we do in exercise, that we perform excessive work, and our skeletal muscles, they play an important role in performing a particular activity or exercise. So during that condition, our skeletal muscle metabolic activity, it will enhance. This enhancement of metabolic activity, it is metabolic activity of the skeletal muscle will increase. This means that the demand of oxygen and the demand of nutrient to that of the skeletal muscle will also increases. For example, demand increases. So if in heavy exercise the blood vessels remains as same and the metabolic activity in the muscles keep going on increasing, then what will happen? That if the metabolic activity which is occurring in our skeletal muscle, they are using oxygen. For example, here a certain amount of oxygen is provided by this blood vessel to the our skeletal muscle fibers, and they perform the process of contraction and relaxation. So they are using oxygen, they are using nutrients, they needs calcium ions, they need certain other metabolites for the process of metabolism. So for example, here the oxygen concentration is provided by the blood vessel. When the metabolic activity increases but the vessel diameter, it remains the same, it means that oxygen demand is that of the normal condition is increases. Once the oxygen demand increases, the vessel should dilate it and should provide it more oxygen to the fibers. If this vessel will not dilate, will not provide excessive oxygen to that of the fibers, then a state of hypoxia occur in these tissues, that the demand of oxygen become reduced as compared to the normal, because in normal condition, if 50 50% of 100% or something, or 20 milliliter or 90 milliliter or 45 milliliter is providing to the secretal muscles in normal condition. But in metabolic activity, enhanced metabolic activity, the oxygen demand increases, so the vessel should have to dilate it. So in this case, what happens, that certain vasodilators are released. Vasodilators are released by muscle cells and endothelial cells. These vasodilators, they act on the endothelial cells and cause the vasodilation. So once they act on here, they cause the dilation of these vessels like this. Now the oxygen is increased here, oxygen level increases, nutrition also increases, and commonly the blood volume increases. So we can say that due to the rapid metabolic activity in our secretal muscles, the oxygen demand increases, and to fulfill this oxygen demand, certain vasodilators and mediators, they are released by the fibers or the cells of the secretal muscle, in which cause the vasodilation of those arteries and those blood vessels which providing blood and oxygen to that particular secretal muscle. So here we can say that more blood is flowing toward the secretal muscles. This means that here the muscles are getting more oxygen, or we say that this condition is hyperemic, because here the oxygen, here the blood level increases as that of normal. Normal, if consider that normal for example 2 liter blood is flowing here, comparison for example. So what happened, the concentration of the blood is increased in hyperemic condition, so that 2 liter may be reached to 3 liter. So this is what we call as hyperemia, and this hyperemia is due to rapid metabolic activity, increase in demand of oxygen, and due to release of vasodilator to fulfill the demand of oxygen. This is what we call as active hyperemia. This is what we call as active hyperemia. Active hyperemia. So this process is compensatory process, and we called this process as a local system or local compensatory system. Okay. At the same time, for example, during exercise, here occurs hyperemia, vasodilation, and more blood flow to the secretal muscles. At the same time, certain other organs, for example GIT, blood supplied to those organs which are not taking part in heavy exercise, the blood supply to that particular organ will decreases. So blood supply to the secretal muscle increases, and the blood supply to the GIT, it decreases. So hyperemia occur here, and here low oxygen decreases to that particular area because it is not taking part in the heavy exercise. So this is what we call as active hyperemia. And the second condition is called as reactive hyperemia. Reactive hyperemia. So reactive hyperemia is also a transient hyperemia. It is called as transient hyperemia. For example, I made you hurt here. Example, this is your heart, and these are the coronary arteries providing blood supply to the heart. So for example, here the coronary artery, it becomes spasm or occluded, or we may say or spasm, or due to some obstruction it become occluded for a period of time. So here the oxygen to that of the particular region of heart decreases, and once after treatment or due to vasodilators, the artery that is providing blood supply to that particular region, they again come to its normal position. So what, for example, it is blocked, I suppress this area, blood supply to that particular region decreases, hypoxic state or ischemic state, and after this, when I release the pressure or when this artery comes to its original position, the rapid blood flow to that of particular region occur. That, for example, I will give a best example. For example, water is coming to this canal. Water is coming. I block the water. Water will accumulate here, and when I remove this blockage, the maximum amount or a large amount of water, blood or water will move forward. That when I block, water accumulate, and when I release the blockage, the water move down with a rapid flow, or we can say that the water will be more than that of normally flowing water, because I make an obstruction there, and this obstruction is to the accumulation of water to this particular region, and when I remove the blockage, maximum or a very large amount of water go forward. So here again the same condition is here. I block this, or it undergoes some vasospasm due to certain chemical mediator or some other things, block for a very transient period of time, for a very small period of time, and when this again comes to its original position, a rapid flow of blood will come to that particular region. A rapid flow, a large amount of blood will flow for a very small period of time. So this is called reactive hyperemia. It means that a transient rapid flow of blood after any obstruction, after arterial occlusion, after vasospasm to that particular region, it what we call as reactive hyperemia. Understand? So this is about the reactive hyperemia. So we will discuss hyperemia in inflammatory conditions. So hyperemia in if inflammatory condition is, it's a very long and very huge topic itself. It is under the process of inflammation, it acute and chronic inflammation. So I will give a little concept. So for example, this is your cell and this is your blood vessels. For example, a microbe enter in your body here. So the macrophage cells present in interstitium, what they do, for example, this is I made a macrophage cell. So this macrophage, they have the toll receptors and the bacteria has its antigen on the surface. So the bacteria, the macrophage come in, stuck to the bacteria and it try to engulf the bacteria. For example, now this bacteria is inside the macrophage cell and it caused the destruction of the bacteria. It destroyed the bacteria and it present the antigen of bacteria on its surface like this. And this molecule which is presenting the bacteria, this is what we call as MHC class 2 molecule. And here we can say it is a toll receptor. And this is what we call as macrophage, phagocytic cell. And this is, bacteria I made here. Bacteria. And this is bacterial antigen. So after destruction of the bacteria, it will present the bacterial antigen here, and this macrophage then travel a huge distance and it will go to the lymph nodes, and here they present this antigen to that of the T cells, and then they start forming plasma cells. This is a separate topic. So at the same time, when it engulfs the bacteria present, is the macrophages start releasing certain vasodilators, prostaglandins, NO2. So these are the mediators, for example, prostaglandins. And here again other group of cells present here, for example mast cells, and these mast cell releases histamine. Releases what? Histamine. So these mediators, prostaglandins, histamines, they will go and they have a receptor on the blood vessels. These are the endothelial cells. So once these mediators reach here and attach to the receptor, they cause two things. Number first, that they cause to increasing the vasopermeability and cause the vasodilation. So they cause what? Number one, vasodilation. Number two, they increase the permeability. Permeability is also increases. So the reason of vasodilation here is that more neutrophil will reach and more blood will come to that particular area. So now it is vasodilated. It undergo dilation. So this dilation and increasing permeability cause the excessive blood flow to that particular this region. So more blood flow means more cellular components, more neutrophils, more monocytes, they will reach here. More and more complement factors also, they reach here and they cross the membrane and come to the interstitium, and they cause the destruction of the bacteria, and they start to engulfing the bacteria is present here. So this is what also called as hyperemia, and this hyperemia is due to the mediators or the vasodilators released by the phagocytic cells or inflammatory cells. So in order to provide good blood supply, in order to provide a large number of neutrophils, in order to provide heavy or large number of complement system, in order to reach other some coagulating factors or other components of blood to that particular region, to compensate this inflammatory mechanism, this phagocytotic process, the vasodilation occur. So it is also called as hyperemia. Due to this hyperemia, we can feel some swelling and redness after inflammatory process. So during inflammatory process, we can see the vasodilation, which leads to swelling, and hyperemia, which leads to redness of that particular area. So this is the two sign of inflammation. Thank you.